Hello, parents and students of the Muroc Joint Unified School District. My name is Kevin Cordes, District Superintendent, and this video is intended to speak about COVID-19 tests. So first and foremost, earlier this week, we sent out some notifications to students and parents, and it was related to giving a written authorization so that in the event a student is at school and is exhibiting COVID-19 symptoms, we would place them in a quarantine room. We would still contact you to get permission to do a nasal swab. It is a rapid antigen test, and within 15 minutes approximately, we would be able to tell you definitively whether or not your child has COVID-19 or test positive or not. Just to clarify, we would still, that written permission was just to have on file, but we would still give you a phone call. If you would like us to do that for you for free, we'll be willing to. It'll be done by trained people who have gone through a CDHP training to do so. Or if you don't want us to, we're happy to not do so, and you can come and pick your child up and take care of that yourself. For student athletes, we made an adjustment this past week at a board meeting. We had to make a very quick adjustment due to an outbreak that we had with the Desert High School football team. We wanted to address what we could do to help students continue to play sports. And so we now have a board policy where all student athletes must participate in a weekly nasal swab. It's a rapid antigen test. And the way it works is this. It gets a little complicated, but I want to walk you through it. If we had a student, we're going to talking about student athletes. Say we had a student athlete who's exhibiting symptoms and test positive. Those students who have been fully vaccinated, whether they were wearing masks or not, would still be able to continue on with practices and sports. Those students who were not fully vaccinated would need to go home and be quarantined. At the 5 to 7 day mark, we would be able to give a rapid antigen test again, another nasal swab. And if they were negative and they were asymptomatic, on that 8th day, they could come back. If a student, for whatever reason, did not want to be tested again a second time, even though we're requiring that students be tested at least weekly, I'll at least go down that road and pretend that they didn't want to. They would need to sit out for at least 14 days. So for those students who are fully vaccinated, even though there might be a positive test, we could continue with that sports program with those students. Those who are not fully vaccinated, we'd still be able to shorten that timeline from that 14 days down to finishing up the 7th, and then on the 8th day they could come back and participate in sports. So I just wanted to clarify that. Another thing I wanted to clarify was that everything is done in privacy, whether it is a student that's in school or if it is a sports student. Any of the materials that we collect, there was a person or two that was on social media and wondering about the DNA and maybe we were collecting their DNA. We're definitely not doing that. Just like we would with medical waste, it goes into appropriate disposable bags, and we throw those away. They're disposed of appropriately as medical waste. So there's no intent whatsoever to try to collect anyone's DNA or anything like that. This is completely in an effort to ensure that students are safe, the direct student, and then also those that they might be around. And specific to sports, it's in an effort to continue sports and let it keep going so that students can have these experiences. At least up until last week, we still had Adventist Health, I know, that was coming out to Boron and providing the vaccines for COVID-19. I'm not sure if they'll continue to do so, but there are other places where you can do so. If you feel inclined to do so and you're a student athlete, just know that if you are fully vaccinated and you've had that time with it, then A student that tests positive would allow you to still continue to play. So I just want to make parents and students aware of those facts so that you can make informed decisions for yourselves. We are now going to demonstrate for you how the nasal swab would work. We're going to use one of our children to do that, and we've asked Debbie Tan, one of our district nurses, to demonstrate that. And so we're going to move into that phase and show it to you. Thank you for your understanding and participation, and know that your students' health is first and foremost in our minds. Thank you very much.
Hi, thanks for joining us on this video. My name is Debbie Tan. I'm the district nurse. Today, Damon and I are going to show you and your child what to expect if the time comes for them to get a COVID test. So if they present with symptoms of COVID, we'll have them come to the isolation room. After we've determined that they need a test, we will check the consent and give you a phone call and make sure it's okay for us to test them at that time. After we verified the consent, I'll have the student wash their hands, and I will also do hand hygiene and don my gloves. Then at that point, I will explain to your student what to do. We have these swabs here, and they're expected to do the swab themselves. If they aren't unable to, I will do it for them. So at this point, I would hand the swab over to the student and tell them that they need to insert all of the Q-tip in their nares and rub it in each nostril for 15 seconds each. And Damien will show you now. Okay. So you can see it's very easy. It's non-invasive. You don't have to go very deep into the nose. Does it hurt? No. And then after 15 seconds, he'll do it again. And they're gonna, there you go, perfect. And we'll monitor them and watch to make sure that they're doing it correctly. At this time, I will get the card ready. There is a reagent here that we add. I take the swab, put in this card, close it, and we wait 15 minutes for it to result. So after 15 minutes, I will phone you, or the health aide at the school will phone you and let you know the results. So if you have any questions or any concerns, you can always call me or the district office. Thank you. We have a couple samples to show you. This sample is a sample of a negative COVID test. So you can see that there's only one line present there. And this one is a sample of a positive test where there's two lines present. So when we're done, again, we'll just throw them into the medical waste, and it will get discarded appropriately. Thank you.